I wanted to break this down, and we use them quite a bit in my practice to treat obesity, to treat diabetes, to treat cardiovascular disease, to treat Alzheimer's, even in our type 1 diabetics. We use them to treat insulin resistance, which is the cause of the majority of the metabolic diseases. Even PCOS, when women are infertile, far better than putting you on metformin. So there are tremendous benefits, in my opinion, and in my practice evidentially. So this is not just my belief. This is the evidence is there to using GLP-1s to treat insulin resistance. However, when a doctor writes a prescription and says, here you go, off you go be skinny, go get rid of your diabetes, and it's monotherapy, that's where the harm comes in. That's where the failures come in. So if you look at the step 4 trial data, this was a study where they put people on Ozempic for a period of a year, and then they took half those people and they put them on a placebo for another 48 weeks for the second part of the year, and others stayed on the GLP-1. They showed at the end of the GLP-1 period a weight loss of 10.9%. So if you're a 200-pound adult, you would have lost 20 pounds. They then showed over the ensuing 48 weeks, less than a year, a 7.9% increase, regain of that weight. So over the course of 48 years, so about 48 months, so about 10 or 11 months, you'd regained 14 or 15 of the 20 pounds you lost. And by a year or a little bit longer than a year, not only have you regained that weight, but you've regained more than you should have, more than you started with. So there's a rebound weight regain. And the reason for that is because it was used as a monotherapy, as a single therapy. Off you go, calories in, calories out, exercise a little bit, and it doesn't work because you haven't changed why you gained the weight in the first place. Same thing with the diabetes. It does treat insulin resistance, but the result fades unless you work with it. It's an integrated approach. So the GLP-1s have fallen on hard times. Plus, if you use them as monotherapy and you don't change your behavior, you feel miserable when you eat carbohydrates. You have acid reflux, your bowels don't work, you've got gastroparesis, you're throwing up, you're miserable. And also, if you use it for a long time, your muscles waste away. Why? Because you're eating a plant-based diet, you're not eating adequate protein, you're not able to metabolize that. So a lot of negatives have happened despite the fact that this is the single most effective non-dietary manipulation of insulin resistance. It is an incredibly powerful drug. And I will tell you, it's as powerful as bariatric surgery, as obesity surgery. And I'm a bariatric surgeon. So these drugs are incredibly powerful. We use them a lot in our practice, but always multimodally. So what I'm going to talk about now is what the best strategy is if you are going to use a GLP-1. And these are certain absolute musts, in my opinion. If you're going to use these medications, I'm a strong believer that they are an excellent resource as a tool to help you on a journey, not as an outsourcing. But if you're going to do this, GLP-1 receptor agonists or other incretin medications, Mounjaro, that kind of thing, and the new ones coming down the peak, there are certain things that you must do to prevent the side effects or reduce the side effects to incrementally increase the benefit and towards sustainability. And this is my list. So before we go through the list, I just want to tell you what the benefits of GLP-1s are. GLP-1 is a natural hormone that gets released by the gut. What this medication does is it makes that effect more powerful. So first and foremost, in the intestine, yes, it slows down the rate of emptying of the intestine, but that's what bariatric surgery does, even more powerfully. You put a balloon in your stomach, you band, a bypass the sleeve, it slows down the rate of which you move, you eat less often. Well, if you're stuffing your face all the time, it's going to clash and you're going to throw up. You're going to feel miserable. So, but if you change how much you're eating and how often you're eating, then you're going to use the gastroparesis, that delayed emptying, the slowness of the gut that is caused by these GLP-1s as a benefit to drop weight, to reduce your insulin resistance. So use that beneficially. But yes, in the gut, they do slow down gastric emptying, but that is not permanent. That gastroparesis is not permanent. And in fact, diabetes is by far the commonest cause of gastroparesis. So diabetes slows down the gut anyway. Ask any type 1 diabetic who's been diabetic for a while. They all have gastroparesis. So don't blame the medication for it. The medication's supposed to do that, but it goes away when you come off the medication. So the gut emptying, you're not going to poop as much, but that's okay. Don't eat as much. Change your behavior. We'll get to that. The most important effect for me is the effect GLP-1 has on the pancreas and the liver. In the pancreas, it increases insulin secretion. So you get a bump in insulin. And remember, type 2 diabetes is where you're hyperinsulinemic, but you're producing less insulin than you are insulin resistant. So it increases insulin secretion. It also decreases glucagon secretion. So glucagon paradoxically does not add sugar to your bloodstream, and insulin clears it better, so you reduce your blood sugar. In the liver, because it reduces glucose production, reduces glucagon, it reduces glucose production, reduces the production of glucose from amino acids, from protein, and reduces the release of stored glycogen from the liver. In the muscles, it promotes sugar uptake, which is an insulin effect. So it promotes glucose uptake and storage in the muscles. So you're distributing sugar to your muscles rather than having it lie around in your bloodstream or your fat cells. It does also increase the amount of fat that gets deposited in the fat cells, but because you're eating less, you're actually using fat rather than the other way around.